Hey guys, welcome back. Today we are talking about nausea or sickness that we experience, whether it's either up in the neck, in the mid-sternum area, or in the digestive system, so really low in the belly. So wherever that nausea sits along that chain for you, these specific acupressure points are going to be fantastic in targeting and attempting to relieve some of that pressure and that tension. So what we got in this series is 2 points that you can try. Our first one is commonly known. You may actually have seen when people get seasick, they wear these little bands, or if they're flying and they get nauseous, then they'll apply this little pressure band that exists and it presses through that point. And this is exactly what we're trying to target today. So this is an acupressure point that opens up and relieves pressure basically from the neck all the way down and improves the digestive system. So what we're going to do is we're going to start at that wrist crease, and essentially anywhere here that you feel like a tender point in between these two tendons that run here, I want you to press that. Now, characteristically, it's about 3 fingers up, but what I want you to do is just find wherever that tender point is for you as you press through that area. I want you to press and massage for around 5 to 20 minutes. So just finding wherever it is along that area. It might just be the whole area, in which case you can just massage and press through that as is comfortable for you. But if you do fall on a really tender point, just massaging and pressing through that again for about 5 to 20 minutes. Did you feel any pressure? No. So it feels good. Amy's not nauseous, not sick. Perfect. So just massaging through that and giving that a crack. Our second point is really fantastic for not just nausea, but opening up the chest. So shortness of breath or pressure or tension, which is characteristic of pain, we want to constrict and contract down. We want to open up the chest, and a lot of times when it comes to the digestive system, because it's such a long process from mouth all the way out, we want to focus on alleviating as much pressure along these areas as possible. So the second point that we're going to do, we're going to locate and identify this notch in your throat. So where it just drops and you hit bone, connects to the sternum, and you've got your clavicle, so your collarbone that runs out here. We're going to find where that notch is. Then, depending on your individual physiology, because it's different for everybody, what we're going to do is we're going to find that clavicle, we're going to find the sternum, and we're going to drop down and to the outward. So down and to the shoulder. And you find a tender point through that area. Everyone, it might be a little bit different for you. It might be further along, it might be further down, but there'll be a tender point that you'll feel, maybe on one side, maybe not on the other side. And you want to gently press and massage through that area. So what that's going to do is going to descend all that blockage and that compression. It's going to open up the chest, so it's easier for things to flow naturally than the body, and make it a lot easier. So we're just going to show you on Amy, because she's a lot different to me. We're going to identify and find that notch. We're going to find that clavicle and that sternum, and there should be a tender point. See where it's slightly red, where Amy's already been pressing. There's a tender point just through there. So on both sides, just underneath the sternum is that acupressure point. So again, just finding the most tender point and trying again for 5 to 20 minutes. So you can use these two in conjunction or separately, whatever works best for you.